pay like $10 to even access the phone. It's up in the Ventana Mountains near near Santa Cruz, near Pacific Grove, actually. It's probably the nearest city. Are we good to go here?
Yes.
Shoshana?
Go for it.
Okay, so I thought what I would do first is introduce myself, and then Shoshana has some webinar instructions for folks, and then we'll just zip on into this. We will be out of here at 3 o'clock today. Somebody asked me, and I really am a believer in following the timeline. But we do have one change to our agenda, which I'll tell you about later. So my name is Susan Morris Wilson. I'm actually, I live up in Shasta County. I have served on a mental health board. I've served on the board of the California Association of Local Mental Health Boards and Commissions. I didn't know if you had changed to behavioral health.
Correct.
Right, behavioral health. I currently sit on the California Mental Health Planning Council, for those of you who are familiar with that body. So I know quite a lot about local mental health boards. I think I was on my local mental health board for an excessive amount of time, like 10 or 12 years. And one of the things that I discovered when I was on my local mental health board is that there's quite a lot of turnover on local mental health boards, and there's a need for people who sit on the local mental health board to understand what their charge is. Why am I here? What am I supposed to do? And then to convert that information into something good. So I worked with Shoshana, and we came up with training that we did back in April. And that training was actually a training for trainers to train local mental health boards and commissions. And so we have a manual now that you can download from CIBHS that has every word I say today is probably in this manual. The manual is not what we're here to talk about today, but it is a great piece for you to have. We tried not to make it excessively long. The previous manual was something like 120 pages. This one is a much more reasonable amount of pages. If you want the backup, yes.
And it's available at you're kind of pointing back there.
Shoshana, maybe she can write up here for you where to find it on the web, on their website. So this is a tool that every mental health board should download. And if you want training, you can contact the CALM board. There are representatives from every area, and they will send somebody out. Could be me, could be somebody else, to do training for you, for your board. I made it so that you can do the training in 20 or 25 minutes, because sometimes that's all the boards have, or you can do a couple hours. And I think I set it up ideally for a couple hours. So that's one tool that we will be working on.
Is that training different than the training we're getting today?
Not much.
Okay.
This was actually a training for trainers, so that I could, May, I believe you were there, were you not? So that May would have all the tools she needs, the PowerPoint and all, and you were to take away with them. So today is the refresher course for that. Shoshana, do you want to give webinar instructions now? And then we'll wander on into our topic here.
Are we going to do introductions?
Yes, we will.
All right, for all of you who are on the webinar, and it looks like we have about 10 people on the webinar, you are automatically in mute mode. We do that because otherwise we end up getting feedback and echoes on our end. So we are happy that you're with us, and if you have any questions during the training itself, we would ask you to please either type them into the question box that you should see on your dashboard, or you can click the hand icon next to your name, and that will alert us that you would like us to take you off mute so that you can ask a question. We prefer if you would submit your questions in writing, just to to allow the flow of the conversation here to kind of go a little more smoothly. But at any time, if you have any questions, type them into the box, and we will do our best to answer them. Also, we're recording this webinar, so those of you who can't stay on for the entire thing will be able to catch up later, and we'll also be able to share the webinar link, recording link, with others who weren't able to be on the webinar today. That's it.
Okay, with that, let's go around and at least get the folks in this room introduced so that you know who's here and who you might want to know. And May, I think we'll start over here with you. Could you tell us who you are, where you're from, why you're here?
Well, my name is May Farr, and I'm from San Bernardino County, and I happen to be up here in Sacramento at another board meeting, so I decided to take this one in, although I did do the other section that we had at the actually it was our meeting in April. And, you know, and I'm here to learn, because I know you can always learn something, so anyway, I'm just happy to be here.
I'm Cheryl Banbury. I'm from the Grand Valley Mental Health Board. I'm brand new, so I've done a lot of board work, but never been on this particular board. And it's the Nevada County Mental Health Board.
I'm Kate Gaston. I'm with the Mental Health Board for Mendocino County, and I've been on the board for 1 year. I have a lot of background in working with boards from other communities and other mental health advocacy groups, but this is my first time on a county mental health board. And I'm here because, first of all, our board wants to do things really effectively and make a real difference in the county. There's been a huge changeover in the board membership. We have probably half our board members who came in when I did or since then. So that's a big change. We had a board member who went to the training for trainers, so our intent is when I get through taking this one, I'll go home. We'll have a couple of debriefing and set ourselves up to actually do the training for the board. That's just great.
Hi, good morning. My name is Annie Henrich, and I'm on the board of the Stanislaus County down in Modesto, so in the valley. And we have a few of us here. So, well, this is my 7th year on the board, and I'll tell you, the first couple of years I was there, I didn't know what to do. So it's getting a little bit better. So when I found out that there is this training, I signed up. I said I would like to go, and then when we come back, I'll bring back whatever I have and share with the rest of our board. We have right now on the board 12 members. We need 3 more. So we are going to be out recruiting and out being part of that group. So I hope this is going to really give me a lot of
Right. So this afternoon, I'm hoping, this afternoon is about community outreach and advocacy, but one of the things I was going to focus on was recruiting members for your board. So I thought that would be a useful thing for you.
Thank you.
My name is Tony Flores. I'm from the Mental Health Board in Stanislaus County. I'm here because my dad is the director of mental health in Alameda County, and I just want to make a contribution, see what I can learn from my experience.
Thank you. Thank you for joining us.
Bob Shalane, Mental Health Board of Yolo County, and I'm here to learn whatever I can to make us a more effective board in whatever way possible.
Great. Thank you for joining us. We'll come over here. Everybody knows Kelly.
I'm Steve Clavera from El Dorado County on the board. I'm also a member of the California Association of Local Behavioral Health Boards. I missed your presentation in April, so I thought I'd come here today.
Great. Great. Thanks. Thanks for
I'm
joining us.
Leslie Wilson, and from Lake County. I'm on the mental health board there, and I came to learn, of course, as much as I can. We have been on the board for 2 years, and still they're very ineffective. And we recently watched an older webinar. It was downloaded, and we watched it, and they decided, well, maybe we'll just disband the mental health board. You know, I don't want to be political. They said, well, then one can't do that. And so I thought that I'd get as much information
share with them if there's anyone there.
Many mental health boards are having trouble keeping their board up to capacity.
That's sad, but it's good to hear that we're not the only one. Right.
You are not.
You are not the only one. My name is Jane Sweeney. I'm chair of the Mental Health Advisory Board in Alpine County, just down the road, up the road from you, however you want to look at it.
That might be the smallest county
It
in
is.
California,
It is.
I believe.
We have 1,100 residents or members of our county, and but we have one of the largest counties geographically because we're mostly, Bureau of Land Management and federal park systems and stuff like that. A few little people clustered together, and if we get 5 people at our meeting, we're doing well. Yeah, because we have people that have to come over from Bear Valley. That's about a 2-hour drive. People out in Kirkwood, which is also in our county, but in the area. So it's a little tricky, but we have made some wonderful improvements. We have a director that's just been with us about 1.5 years, but we have expanded our programs, and a lot of good things are going on. So I'm anxious to find out, how I can kind of manage this and run the meetings better and learn a lot.
Well, welcome.
My name is Stephen McCormick, and I'm chairman of the Mental Health and Substance Abuse Board for San Joaquin County, and that's in Stockton, California. And I have the good fortune, like I said, to be the chair. We have I think our board is relatively effective. However, there's room for improvement, and I have some ideas in making some changes and improvements in doing outreach to the community, not just focusing in the mental health at our behavioral health site, but actually to involve the community. And other ideas, among them, to change our name from the Mental Health and Substance Abuse Board to get back on behavioral health like most people are doing. So that's on my agenda as well. I did attend the training for training the trainers. However, I got a little bit shortchanged on that program because my flight back here to Sacramento, I had to leave 2 hours early, so I didn't complete the training. However, it was very good, and just as it was getting rolling, it's time for you to leave. So I'm coming here to like a refresher. Not only that, but I want to learn as much as possible, and also to network with the folks that are here in attendance. And so I've already spoken to a few folks, and it's very pleasant. This is a very, having a smaller group, it's a lot easier to do these kinds of things than in a group of 100 people, say. So it's very cozy here, and I'm glad to be here.
Great. Happy to have you.
Yes. My name is Yvonne Bond, and I'm a board member with the Placer County Mental Health and Drug Board. I'm a brand new board member, and I'm new to actually being on a board. So this is an excellent opportunity for me to learn what's the best way to be a good board member. Placer County is actually has a very good board. It's very energetic, creative, enthusiastic. So it's a kind of a fun place to be for me because I'm really interested in advocacy for the mentally ill. I've got a family member who's mentally ill, so it's very close and dear to my heart. I think this is the best way to actually affect change where needed. So I think that's what my purpose is for being on the board.
Great, thanks. And I'll catch her at the end.
Good morning. My name is Arnie Zeiderman, and I live in Amador County, which is about 45 miles, 44.1 miles.
To be exact.
From here on Google Maps. I'm a member of the advisory board, the Behavioral Health Advisory Board in my county. I was appointed by the supervisors within the last 6 months. I've been involved in trying to improve some of the lack of services in our county for mental health, acute services, for severe mental disorders. And as is common in many counties, not only rural counties, there are a lot of deficiencies in our county. Wanting to see if I can help the advisory board become more effective in dealing with the issues and presenting some options and alternatives to the supervisors so they provide services that are very difficult to provide to the citizens. Thank you very much for providing this course.
Thank you. And down here, could you just introduce yourself, your county, and why you're here?
My name is Yvette McShannon, and I'm representing Stanislaus Mental Health Board, and I'm just glad to be here.
Great, great. So on that note, we'll get started because we've got lots to do and time is a-passing. In your packet, we're actually going to work on this side of the packet. My right and left is a little challenged, so under this part. So you have a copy of the entire PowerPoint. Shoshana, can they get this PowerPoint also at your site, or?
Yeah,
They will.
It will be posted for you.
Posted, yes.
So the main reason we gave you the PowerPoint was so that you could make notes and so that you wouldn't have to stare at the screen and you could look at me instead. I actually really like people to talk to me through the presentation, ask questions. If there's something you don't understand, I don't want you to save it for 2 hours from now. I want you to just sort of sneak your hand up in the air, say, could you just clarify that point a little bit or whatever. The second thing we have is actually we have 2 copies of the Roberts Rules quiz, but we only need 1. And we have the answers to the quiz. This is really kind of a fun thing to do with your board, I'll be bluntly honest, because lots of boards don't understand Roberts Rules. We're going to go over them a little bit. We have a sample of a facility monitoring checklist. The reason that we're using this checklist is because I wrote it years ago when I was on the board. And it's just something, it's not a formal document, but it's something that you can use if you go out and look at facilities. We're going to talk a little bit about where do people live that you serve, and how do you, I mean, some of them are licensed, some of them are not licensed. These are licensing regulations. But even if they are not licensed, those folks deserve to live in a place that's livable. These are livable criteria. And then finally, I provided with you in green a couple of different documents. One is a board evaluation. And one of the things that I feel is that it's really important as a board to evaluate your own performance. So this is not something that you want to leap right into. And I have to tell you, this is something that you'll probably run into a little bit of pushback from your fellow board members. But it's just something for your toolkit. And if things are not going well with your board, maybe you can say to them, I think that we ought to take a look at what we do and how we do it. The other one is a mental health board evaluation for meetings. Some people have meetings that they feel do not go too well. This will give you some ideas about some of the important factors in having a board meeting go well. So these are just a few tools that we provided for you, also will be available to you. And with that, we're going to hit the boards here. Again, let me remind you that if you have questions, please raise your hand. So, characteristics of a great board. Tell me what you think. I mean, you can look at this too, but what is the one thing that would change your board? Let's have a little discussion here. Characteristics of a good board. People come to the meetings. Board members are prepared. Yeah, they come on time. Board members are prepared.
Well, yes. One of the issues that seem to come up sometimes are that some of the board members did not read the materials that are put out by our agency, like Children and Youth Services.
Right. So you want them to be prepared when they walk in the door. You want them to have looked. The whole point of the Brown Act is to provide you with that information before you get to the meeting, so you don't have to make a fool of yourself by saying, "What are you talking about?" You know. So one of the things that you'll hear me mention from time to time is that we really need to mentor new board members and call them up and say, did you read your material? You know, if I was the chair, I would do that. Yes, Arnie.
Well, you don't say anything about the leadership, about the qualifications or obligations of the person that's chairing the meeting.
Mm-hmm. So that's right.
I think you should add it to that.
I will.
If you don't have an effective leader,
it takes
knows their job, it's never going to work.
So what Arnie's saying, for those of you, I don't know how well you hear on the webinar itself, but Arnie says you have to have a good leader, a strong leader. And several of you said, I am the chair of my board, and I am here because I want to have a stronger, better board. And really, if you have somebody that sort of kerfuffles around, you know, it is difficult to accomplish things. So an effective leader, and I will add that. I will borrow your pen, and I will add good leader. I like that pen. That's a nice pen. But I won't steal it. So good boards also assess their board performance. I heard several of you say earlier, you're there because you want good services for the clients. So that's another piece of having a good board. You determine, monitor, and strengthen programs. I talked a little, yes?
I think this second one, have effective organizational planning. What I see is the struggle that the board comes together for. We need more information. We need a space where we have dialogue. So when reports are presented to us, discussions held, we have more background information on the topic. So the balance of meeting time versus time you need to really learn about the topic. You need the time you learn to have discussions as a board, that they're all public, but you need to still have these discussions in order to have a consensus of understanding to even get to having a solid vote or decision-making process. That really, for us, is the crux of the struggle we've been having. So we made a decision a year ago that we would become more knowledgeable.
Oh, I think that's great.
So that's taking more time at our meetings to become knowledgeable as a cohesive team than I think people would like to see happen in a public setting. So that's really kind of our struggle right now. I don't know if other people can relate to that, but
you know, I think that's a really good point, and I know that that's one of the things that the CALM board has actually. I don't know how to say it other than CALM board. I can't make a B in the middle of my CALM, my cabal board. So the CALM board, you know, is how do we get that knowledge to local boards? Is there a better way to do it? You know, one of the issues with local boards has always been, I'll call it loosely, funding and sending people to conferences. I mean, there are some really good conferences that go on, but we don't always have easy access because, to be honest, most of them are in LA or Sacramento or San Francisco. If you live in Alpine County, it's not that easy to get there, you know, and it costs money and you stay overnight, so it's
all downhill.
It's all downhill.
I don't know about all your other boards, but I know as board members, we are allowed to go to any of the meetings that are conducted in the county. I go to administration meetings, I go to, you know, meetings, I go to all their meetings, and to learn about what's going on. That's the one way you can do it. But all the meetings, well, we've already had many, many meetings with the Mental Health Services Act, but we also went to all of those. So, you know, I think you can learn a great deal by going to, you know, your community-based organization meetings or anything like that.
Yes, Arnie?
So I did want to reinforce, even though I added something, that your number one bullet point is the most important. And I think that the overwhelming majority of the people that I've interacted with in the county, on the board and elected officials, that really don't know.
I would agree.
Do not know the purpose of the organization. It's very unclear what authority or lines of accountability are. I know in my county, as far as what the people that administer the mental health services Act money, which is very substantial, exactly who they're accountable to, and I think they don't think that they're at all accountable to the advisory board. And right.
Right.
Exactly.
So know the
All the
purpose.
people that have all the money, and all the
Exactly.
power, and all the jobs feel they're not accountable to the advisory board, then it's really hard to make your advisory board effective. You have to figure out a political solution. Because my understanding is that it's an advisory board to the board of supervisors.
That is exactly correct. That is exactly
So
correct,
then we
because
got two
that's the
different channels going.
legislative
Okay.
body that
That's-
appoints you.
Okay. So that's why I'm here to learn this, because it looks to me like there's two different channels. And how do you get resources? What county are you from?
Mendocino.
Mendocino. Well, it's similar to Amador, and we have Placer, all these counties are very, very similar. We have these kind of problems. So I do think that's very important. And frankly, I'll just tell you this, that I got involved in this about a year and a half ago, and when I did and had a organizational meeting in the county, nobody even knew about the board, and most of the people that were involved with health services in the county didn't know hardly any of the members of the board, including the health officer. So this whole process of educating and defining what the purpose is, I think, is really essential. Otherwise, you just spin your wheels, and that's
right.
why it's helpful if you can.
That's right, and
you can
I'm going to
duties and responsibilities.
That's what I'm on today. And you
Good.
had one last comment.
Just going to add, in terms of the issue of information, basically, our job is to monitor and review the delivery of mental health services in very broad terms. Well, those services in our county are delivered by the Health and Human Services Agency, and we're the contractor. But the problem is, you talk about the information we need to get. The information we get is provided by the Health and Human Services. So if you control, as they do, the information you get, then you essentially control your agenda, because they will give you information they want you to have, and not give you information
They
that
don't
they don't
want
want
you to
you
have.
to have. So in essence, they pretty much control the agenda.
So one way to get to strong and effective board is to know what you are about, why you are about that. So everyone should have in their, do you get board manual packet? Everyone, the first page of it should be the Welfare and Institutions Code, section 5604 and following, okay? Because you want to be able to say, when your mental health director says, oh, you don't need to worry about that, you want to say, I want to worry about that. It's my responsibility to worry about that. I should tell you that one of my other things that I do in this world is I am very, very active in the League of Women Voters. So I was on the League of Women Voters California board, my local board, and the board for the United States. So you have to say that I am a political creature. Political but nonpartisan, because the League of Women Voters is not partisan. But really, if you don't know what you're about and you don't know where you're going, you will never, ever get there. So, I mean, that's what I'm not here to say you need to overthrow the government, but I am here to say you need to know what your role in that government picture is, and you need to take advantage of that role. You had a question? Quick, because we got to move on.
But everybody have their agenda, and as being a new board member, you don't want to go in making conflict. So, I mean, what do? You just...
Well, you have to learn first. I mean, if I was a new board member, I have to say I wouldn't go in and say whatever came off the top of my head. I would go in and learn what the culture of my board is. I would meet the people who matter to that board. I would do a whole lot of different things as a new board member. Right. Maybe we should have a class called "You're a New Board Member. What next?"
Yeah.
You like that? I'm going to write that down. You're a new board member. Okay, so the next thing we're going to so now we're going to move right on into the duties of the board that are found in section 5604. Review and evaluate the community's mental health needs, services, facilities, and special problems. Is that a small job? No. That's a humongous job. It leaves things totally wide open for you to look at. So some of the examples you might want to do is you might want to have presentations at your board meetings. One of the things that we do, I'm from Shasta County, so I'm going to use Shasta as an example because I sat on that board. But every single meeting in Shasta County of the board, we have one educational, and somebody talked about that, be knowledgeable. We have one educational 20-minute presentation. So a couple of weeks ago, we had a presentation on marijuana. You know, really, how important is marijuana? What is the prevalence in our community? Who smokes it? What services are there to serve those individuals who need help with it? You know, and so we go through, and one of the things I'm going to suggest to you is that you go through and you say, this year we have whatever, 10, 12, 5, whatever number of meetings you have. These are the topics that we want you to give us knowledge about, and here you go. And then have your executive team work with your director to make sure you get that. You don't want it to be overwhelming. You don't need to know every teeny bit of stuff about something, but you need to be conversant with the topic pertinent to your county. I did give you a copy of something that you can use to evaluate facilities. I know that facilities for people with mental illness, the mental health disorders, are kind of on the wane. You know, if you lived in Shasta County, we ship you to Yuba City, we ship you to Woodland. In your catchment area, we ship you over to Humboldt. We don't have a lot of services, and a lot of you come from small counties, and I bet I'm wagering that you don't have those services either. No. So, I mean, how do you develop facilities for people in your county? You know, think about this in terms of the greater grander, but remember that you're going to have to narrow it to work for what you can do. So we're going to talk about that a little bit. Duties of the board: review any county agreements entered into pursuant to Section 5650. Specifically, your job is not to officially approve the county agreements. You don't have the time, you don't have the ability to go through those agreements that are sometimes 2 inches thick, right? So what you want to know is, what the board wants to know is that citizen and professional involvement has been used in all stages of the planning session. And a part of this is because of MHSA. You want stakeholder input if stakeholder input is needed, right? That's probably the key thing. Not that there aren't other things. You know, I have to say we could spend 8 hours just on the duties and responsibilities of the board. So I am going to sort of gloss over it. But what this does say is you don't have to approve those contracts. You have to approve the method by which the contracts are approved. Got it? Advise the governing body. Who is your governing body? Supervisors. The Board of Supervisors. And the local mental health director as to any aspect of the local mental health program. Okay? That's pretty self-evident, I think. Review and approve the procedures used to ensure citizen and professional involvement at all stages of the planning process. In other words, you want to be the person, you want to be the people that say, did we talk to the folks who use our services before we came to this decision? That is one of your major jobs, because I have to say that, you know, mental health departments have improved vastly in their communication with stakeholders since MHSA, because it was required in order to get the money. You had to show that you actually did it. But time has gone by. It's hard to include stakeholders sometimes. It's expensive to include stakeholders sometimes. Sometimes you have a meeting and you include what I will call the usual suspects. You know, the NAMI people are there, and the facility people are there, and Susan Wilson, who's not on the board anymore, always shows up for those meetings and has something to say. But the group is getting smaller and smaller. You need to think. I come from a big county. Somebody was talking about Bear Valley, driving in from Bear Valley. Are we talking to people in Bear Valley? I want to tell you a neat story about Los Angeles County. Now, we think of Los Angeles County. What does it have? Millions. It has, like, so many people, it's boggling to me. But I was talking with their mental health board recently, and they told me that they actually went and had a meeting up in the Antelope Valley, which is the far northern part, over the mountains into the valley section, just to find out what was happening there. Good strategy. Move your board meetings around. I mean, I also come from a very big geographical county where most of the population does live in Reading, but there's a very active mental health set of issues in Bernie, 80 miles away, and to the north also. So, one of the things that you can do is move your board meetings around. You have to, of course, do it correctly, but move your board meetings around, and you can have a public comment period or a public hearing for the half hour ahead of time, and encourage people to come. It doesn't have to be even over an issue. So one of the things that we're doing at the Planning Council is we are wandering through California, and we sort of pick a topic and pick a place. I think anyone from Fresno? We were in Fresno recently talking to the Hmong community about mental health services, okay? Because we wanted to know. We went to a prison. We talked to them about mental health services. That was pretty devastating, I need to tell you. That was very difficult. So think of what's important to you and who your stakeholders are. I could talk forever. Submit an annual report to the governing body, that would be the Board of Supervisors, on the needs and performance of the mental health system. Do all of you do that? No. To be honest, lots of counties don't. Lots of counties don't. So one of the things that we're going to entertain you with at lunchtime, we're going to have kind of a working lunch. This is not a go out and shop at Macy's lunch. This is a working lunch. We're going to talk to you about the data notebooks. The data notebooks went out last week. And we're going to I'm not going to talk about it now, but Jane Adcock's going to join me at lunchtime, and we're going to talk about the data notebooks. We think that this is one way you can give us information, which the regulations require that you do, and you can give your Board of Supervisors the same exact information and fill out one form. How cool is that?
It's formatted so that
it can be done electronically.
Okay. Well, I guess when I saw that we are supposed to submit an annual report, I guess what I was thinking, well, I'd sure like to see an example of one first.
I don't think there is a format for annual reports. I think that different counties have evolved their own format over time. So good question. Different people do it differently. When I was on my mental health board, I used to write it. And I used to write this vague, general thing about, and it goes back to what you said, everything's swell. There are no problems. And I would go in front of the Board of Supervisors, and I'd read them the report, and I'd have a nice PowerPoint, and we'd be all done, and everybody would go, oh, we're so good. And we'd pat ourselves on the shoulder, and we would leave.
So let me address this point. I'm the vice chairman of my committee, and I'm new on the committee. The chairperson asked me to come today. He also sent me about an 11-page report that he's going to submit to the next meeting for approval. And it's very thorough, but a couple of points are that number one is that I don't know that anyone else got it, so people are going to get something, an 11-page report at the meeting.
That they haven't read.
That they haven't read. And it's very long. And then the other thing, of course, is that the Mental Health Services Act people, they've also put out their annual report, and it's about, it's about that thick. So, we have two different tracks, two different reports. They have all the information, as the gentleman mentioned.
Yes.
They have all the information, and they present the information that they want to justify their intentions. And so I see this as very problematic, and it does seem, by the way, that if the chairperson or the committee is supposed to have a report, you need to tell them what the components of the report are. You can't just say, you have to send in a report. What's a report? I mean, one line, everything went great, right? Or here's 20 pages. So it should be part of the rules. Again, it's not well organized, and people aren't not really knowing what their roles are in terms of the board or in terms of the chairperson is supposed to do or what the report is. So I'd like to see that better, and I'm seeing some things just by sitting here that are issues.
Great.
But how does how can I criticize, I'm not really trying to criticize this person, but how could one be critical of someone submitting an 11-page report?
Right.
And there aren't any rules.
Right.
So who are you to say it's too long?
Right. And so one of the things, even though I'm a very political person, one of the things I have to say is, go to one of my things, you catch more bees with honey. So, I mean, to be honest, you have to develop the culture of your board. And that's one of the things that we're talking about here when we talk about the duties of your board. You have to develop the culture. And you do want, do you not? You want a culture where anyone can speak, right? People need to be able to say what's on their mind. They need to be able to ask questions. And that's why I talked a little bit about evaluating your board, because it can help, especially your chair, who probably has a job somewhere else and does this on the side because they really care, but boy, those meetings come up fast, and I just got this done in time for this meeting. I mean, we've all been there, we've all been there. So think about the culture of your board all through this. How do we do this kind of thing?
Yeah, it's interesting because, we've struggled with this idea of the report too, that there isn't a format, and you look at past reports people have submitted or not submitted, and they're all various. And so we attempted this year in March, we came up with little ad hoc committees.
Okay.
That took like 8 different areas that we felt we needed to make sure we knew what was going on. And these 8 little ad hoc committees then studied these things and then submitted their reports to the department and the chair, who theoretically is compiling those, but having bullets out of that thing and an overall arching thing.
And I think that's a great way to do it.
But what we found is that pressure of only having like 2 months, because we had to turn them all in by May 15th to the department in order for them to go to the board before the end of June, was all of a sudden we've had this intense time period of study and learned a tremendous amount. But the thing that we learned the most was how little we knew.
Yes.
How little we knew. Like my committee we did the whole jail and first responders review.
Oh, that'll be really handy for you when you get to
And that's
this.
what I'm thinking. I'm excited about that. Well, we came out realizing how little we actually had ever known about this. And I think the most important thing about these reports to me and why it needs to go to the board of supervisors is because what we're really saying is that the elected officials and the community at large needs to be much more aware of the problems we're having. It's not about the department. It's about the community supporting these initiatives and understanding they own what's happening to people. So I think that's the real purpose, I think, of the mental health board on a responsibility is to the community, not just the board of supervisors, but the community.
And we're going to actually talk about that this afternoon, and I hope that you bring up this conversation again because it's one well worth our further discussion. Why spend hours and hours and hours writing a report that goes to 5 or 7 people, depending on the size of your county, 5 people get that report. You might get your 10 minutes in the sun.
Right.
I mean, do you want it to go to the newspaper? Do you want NAMI to put it in their newsletter? How else can you use this basic information? Or if you don't want to do what you did, which sounds like a wonderful way to do it, how else can you disseminate the information that you come up with? How do you get people to come to your board meeting? How many of you have a good audience at your board meeting? Okay, well a few.
I think for the audience, 3/4 of them are the contractors that come.
Sure.
You got it.
I mean,
Right, it's the providers.
Yeah,
Providers are always there.
We have but we only have maybe 4 or 5 people from the community.
and that's an issue. I have to say, I'm a contractor. I contract, which is the reason I have to leave the mental health board. I run a substance use disorder treatment program. And in my contract, it says you will attend the Shasta County Mental Health and Alcohol and Drug Advisory Board meeting. At least I have to attend like 50% of them. So, I mean, I go to every one of them.
One problem that we've had, I've been on the board for 8 years, and right from the moment that I joined the board, we were trying to get our newspaper, our local paper, to advertise that we have our board meetings, and they're open to the public. And they say that the answer that I get is that there's over 100 boards in our county, various.
Not a good enough reason.
So they don't want to do that. And from like, I don't know, every couple of years we ask again, and that seems to be one of the points.
So bring that up again so that we can talk about it further. Okay. Review and make recommendations on applicants for the appointment of a local mental health services program. So you should participate in the appointment of your mental health director, whoever that is. How many of you have done that? I actually have, because I knew that I had the right to do it, so I went and I did it. Yeah. And you've done it, and May, I know that you've done it. You've done it in Stanislaus? No, YOLO. The board shall be included in the selection process prior to the vote of the governing body. So before it goes to the board of supervisors, you should participate. You know, I mean, there are many ways you can participate. Just to throw out just a few, you know, you can sit on the interview. I sat on the interviews. You have, if they let you, you have the right to vote. We actually put a big no on one person and kept that person from moving on in the system. You know, again, it's part of the culture of your board and a part of the culture of your county. But if you know that you're going to have a new local mental health director, as the other one leaves, I would say to him, I want you to pass on the word. We want to play. We want to be part of this.
And what about between the time they come and the time they leave?
In what way?
Well, in terms of evaluating the person.
Well, I think that you do have the right to do some evaluation. It's not prescribed, but then again, it can be the responsibility of the board. I mean, I remember, I actually did this when I was off the board. I sent a note to the mental health director and I said, it is really annoying for me that you get up and you talk about all these really important things at the board meeting, but you haven't written one word, you know, and I think that you should have a written report for us so that we can take it home. We don't have to memorize it. We don't have to madly scribble all the information down.
Is that endemic, Dan? Is that endemic?
I thought maybe we were the only ones.
I have a question about that that's really relevant. Our director does the same thing and gives a very good report. Unbeknownst to us, one of our board members was recording the meeting.
Oh.
Okay, give me your feedback on that. Is it legitimate as long as they let the other board members know I am recording this? Okay, so it's you know, because I was kind of taken aback.
I could record it.
You could,
as a total stranger, I could record your meeting. Because it's a public meeting. It's a public meeting.
Okay.
So we're going to get there. So let's. So just to talk about this just for a minute, I have made some notes. So some of the ways that you might participate in this. It doesn't mean that you have to vote 11-1 that this is the right director. What it means is that you might review the application and say this person will do, this person won't. You know, we could live with any of these. You could be part of the interview committee. You could be part of the selection committee. You could actually send a written recommendation to the board of supervisors, who is the hiring group. So just keep those all in mind. You know that there are a lot of different ways to do it. And sometimes you don't want to be sucked into the politics, I might add. So maybe you just want to be the selection. Look at the application. Review and comment on the county's performance outcome data and communicate its findings to the California Mental Health Planning Council. That would be me. And so one of the ways that we have decided to get this information from you is just to get a small amount of information on a specific topic through our data notebook. We are going to talk about this data notebook later. Assess the impact of realignment of services from the state to the county on services delivered to clients and the local community. So do you all know what realignment is? Do you understand the realignment pieces? Not completely. Okay, so let me give you a brief primer, very brief primer. I wrote it out so that I would get it right. So what is realignment? In 1991, the state enacted a major change in the state and local relationship, known as realignment. In the areas of mental health, social services, and health, realignment shifted program responsibilities from the state to the county. Okay, 1991. With that, they shifted money. Did they shift all the money? Who knows? Probably not. But so it really is a realignment. The latest realignment that we have seen is AB 109, right? Shifting people from prisons to counties. It came with money, responsibility, and money. So that's what realignment is. It's a shift of quick overview, shift of responsibility and money to the local level. Okay? So if I looked at this personally, I wouldn't say that it made services worse, because I really happen to be a person that believes on the local level you know what your people want. So I see that as a good shift, personally. Is it adequately funded when it's not funded by the state? Sometimes it's a little trickier to get the money. And you know that when the realignment money from 1991 came, it covered 3 different things. Okay? It covered your sort of public healthy thing, your social services, and your mental health. And mental health has a way of gobbling up money. Social services has a way of gobbling up money. And so there's often some movement of money within the whole realignment pot, depending on what the needs of the county are. So if I were to look at this today, I would just make sure that when your mental health budget is set up, that you have enough money to do, or as much money as you can get to do what you are supposed to do. Does that make sense? Mm-hmm. And a lot of us, they never even tell us what the budget is. Mm-hmm. Yep. We don't know what the costs are. Mm-hmm. You know, mm-hmm. So I mean, you need to. You can't just say, "Show me your budget," because that's going to be meaningless to you. But what you can say is, so I'm really concerned about how much money we're spending in involuntary placement. I think we asked you this question. What does that look like? Can you break it down for me? Can you explain it to me? Can you make it look real to me so that I understand it? So that's what this is talking about. This is not talking about looking at everybody's budget and figuring out how much money should go to social services or mental health. It's talking about how does that affect the clients that I serve. Perform any additional duties. I love additional duties. Okay. So let's just take a quick break here. Not break. As far as breaks go, the bathroom's down the hall. Get up. You need snacks, juice, water. There's water over here, coffee over here. Be sure and just get up and grab those things as you need it. But do you have any questions right now about then the duties? It wasn't a detailed coverage, but do you get a feel for what you're supposed to do? Yeah?
I just have a different idea. It's just my personal view. But, you mentioned about the budgets and all those, and the contracts and everything else like that. I think personally that unless, not the entire board, but unless somebody actually starts getting into that stuff, you're missing the whole picture. I mean, basically, in our county, let's say, I think mental health has something like a $35 million budget, let's say. Out of the county's general fund, the county only puts in $16,000. And yet they have something what they call indirect administrative costs.
And how much is that?
It's about $2.5 million. I mean, so, and that's money that the county takes that is not available
for the use of their county council and all those other.
Yeah, we know what it is, because the direct administrative costs are line items. You can see those, it's indirect. Anyway, so these are I personally think it's all about money. Now, I'm a retired state worker, so maybe that's probably affected my view, but it's all about It's all about money.
It's always about
you
the
can go in and say, well, we feel we need this program, or we feel this need, but then your director will say, hey, no, here's what to do. The good guy. I'd love to do that. You're absolutely, but
I don't have
any money. It's not my fault I don't have any money. Yet they know the budget, and the board members are like rats in a maze. You go up one wall thinking this, and they no, we can't do that. Because you don't have the information you need to make a case for some of the things you want. So I know those documents are intimidating, very, very intimidating. But unless somebody is willing, at least, not to go down every single minutia item, but to start getting a feel for where that money's being spent, you're sitting there in the dark.
And the same applies to the MHSA money.
I'm specifically talking about MHSA money.
I mean, the MHSA money, I remember because I was one of those people that was very active around the time that Proposition 63 passed. And, we had these great dreams about how MHSA money was going to be spent and all that stuff. And I would say that my dreams did not come true, or at least my dreams have fallen off the railroad track in the meanwhile, because we all know that a great deal of that MHSA money has done exactly what it was not supposed to do, and that is it's gone into support services.
Right, and that's called shifting.
Yes.
And it still has
supplementation was the word.
Well, we don't have enough money in the transitional and traditional funding, so let's get a contract and we'll pay for it at MHSA. Somebody's got to say no.
You take that point a little bit one step further. You said that money has gone into supportive services. So rather than what? What do you and why?
Well,
rather than what should it have?
So we're going to talk about MHSA in a few minutes. Okay. So let me remind me when we get there, and then we'll get there. Yeah. Okay. So moving on here, everybody back to their chairs. The next thing we're going to talk about is organizational planning. So when you talk about organizational planning, you're really looking at three different things. All right. You're looking at your bylaws. Do you all have bylaws? Do you have those in the binder in front of you? Yeah. Be sure you. Yes. Good. So you should have your bylaws, and you should make sure you follow your bylaws, and you should make sure that your bylaws reflect what you actually do. Okay. So that's a thing that should be looked at least annually. You should have some kind of annual meeting. You must have already where you elect a chair and you do that kind of thing. That's a great time to look at your bylaws. And when I say look at your bylaws, do you think I'm saying send a copy to everybody and say glance at them? No. I'm saying, your bylaws should only be 4 or 5 pages max. There is no reason you can't take 5 minutes to bebop through those bylaws and say, whoa, we don't do that. Let's fix it. And have an ad hoc bylaw committee to fix it. Right? So make sure that your bylaws are right. And I don't give you much information about bylaws because, again, bylaws are really particular to your culture, your board, your relationship with your board of supervisors, your mental health director. The second,
in addition to bylaws, we're toying with the idea of getting policies and procedures.
Policies and procedures.
Now, correct me if I'm wrong. I was under the assumption, I know that bylaws, any changes whatsoever have to be approved by the DOS. Okay, does that also apply to policies and procedures?
Not usually. Usually policies and procedures can be approved by the body to which they apply. So, one word of advice from a League of Women Voters sort of person is make your bylaws the most vague and general you can make them while including the stuff you have to have. Our name is, our membership is. The kinds of things that I think our responsibilities are. Pull your bylaws from 5604, Welfare and Institutions Code 5604. So that will be also a gentle reminder to everybody about what you have to do. And then write your policies and procedures. This year we're going to hold our meetings on Wednesday nights at 7:30 at, the Boggs building. 56, Welfare and Institutions Code 5604.
That's the WIC.
Yeah, yeah.
Okay, code.
Yeah.
You get that online?
You can get that online. In fact, if you just type in WIC 5604, it'll
Thank you.
take you there. And I'll give you all my cards if anybody needs stuff. Just call me and I'll just, or email me. Don't call me. I'm just recovering from not being called for a week. I got home and there was something like 32 messages on my telephone, and I looked at it and I thought, I didn't know you could get so many. Okay, the Brown Act. All of you really familiar with the Brown Act? Know a little bit about the Brown Act, right? Enough to get you in trouble. Hopefully. So we're going to spend some time talking about that because to me that's critical. And I'll be honest, I am not an attorney. Sometimes I think I know more about the Brown Act than the county council in my county because it really matters to me. The Brown Act matters to me and how it works. Brown Act is different from Bagley-Keene. If it's a state agency, Bagley-Keene is in effect their Brown Act. Okay. The Brown Act is just an open meeting, transparency, sunshine sort of thing. And then Robert's Rules of Order or other methods to conduct a meeting. And I always like to say here that my favorite rules of order are Roberta's rules of order.
Yeah, I've seen it. I assure you, you'll go back to Roberta. We were going to implement.
Roberta's great.
We went to implement it at our for the California Network of Mental Health Clients. So all of us board members, we all got Roberta's rules, and
somebody refused.
You know, we went back to Robert's rules. So
but I am going to tell you how to use Robert's rules that will work for you a little bit. Okay. So bylaws. Did I do something wrong? Okay. So your bylaws need to cover the size of your board, how it functions, roles and duties of directors and officers, which is a question that you asked. And so this is actually a good place to put that. The chair is responsible for these things, vice chair, so on. Rules and procedures for holding meetings, electing directors, appointing officers, conflict of interest policies and procedures. So do you all have those? You know, actually, we don't have them in Shasta County. And then one day they called me up and they said, you can't be on the board anymore because you took over, you know, Right Road Recovery Program. And I went, okay.
They just had all of our board members have to take ethics training.
Right, and we're going to talk about that. You know, so let's start with the Brown Act. I mean, you can find the Brown Act in up there on the internet. There's actually quite a nice little Wikipedia article about the Brown Act if you go to Wikipedia. I printed out most of the Wikipedia one, and I thought it was pretty good. The First Amendment Coalition, they talk a lot about the Brown Act, and they're the people that have brought most of the lawsuits against entities that violate the Brown Act. Really, to be honest, almost nothing happens to you when you violate the Brown Act unless it's an egregious thing. So LA County has gotten into a couple of egregious things. You know, different people do, but I mean, you don't go to jail or anything. However, the decision that you make is nullified if you do not make it correctly. And that can be quite difficult. Doesn't prevent you from not going back and doing it correctly. So we're going to talk a little bit about some of those things. So the Brown Act it just defines the way that the public commissions, boards and councils, and other public agencies in California conduct their business, but it does not talk about California agencies, it talks about local agencies. I'd like to talk about what is a meeting, because I think that that's one of the most difficult things sometimes for people to understand. So a meeting is a congregation of the majority of the members of the group. We're talking here specifically about the Mental Health Board, at the same time and place to hear, discuss, or deliberate on any item that is within the subject matter jurisdiction of that group. So there's a couple really important words here. Majority of the members is important. Same time and place, important. And subject matter jurisdiction of the group. Important. Those are the three most important pieces that you'll see here. So meetings can include things like briefings and hearings, committee meetings, and we're going to talk about that in a little more detail, and retreats. So if your board has a retreat, it meets those requirements. I mean, it's a majority of your members, same time and place, and subject matter jurisdiction. So it is a meeting. So that means you cannot retreat in Hawaii. You have to retreat in the area that you cover. You know, and our board once went up to Mount Shasta, which is a whole 5 miles over the border of the county. Because it was hot, it was summertime, we wanted to go somewhere pleasant, there's a great little place to retreat up there. Not good. You can't do that. So let's talk about committees. So you talked about your 8 little committees.
Short-term ad hoc.
Short-term ad hoc committees. So I want to make sure, I can't remember exactly what it is.
Ad hoc committees are not subject to the Brown.
They're not subject to the Brown Act.
Right, that's why we chose.
That's why you make them ad hoc committees.
Right. But you have to be careful with ad hoc committees because they have to meet a certain definition.
No more than.
So a standing committee is the executive committee of your board, a standing committee, you betcha.
Mm-hmm.
If you have an MHS, we used to have in Shasta County before I became much more interested in the Brown Act, we used to have like the community education committee and the suicide prevention committee and the MHSA committee, and we just had committee after committee after committee. And once I figured out that they had to post all of those and write minutes for all of those, and I made them send a staff person. I mean, they had like 2 staff people. All they did was staff the mental health board, you know, and so we quickly moved on from those.
So the standing committee is subject to the Brown Act.
Exactly.
But any congregation of a majority of the members of the group at the same time and place to hear. So what if your standing committees aren't, roster isn't a majority of the full committee?
Okay, so the rule there is you have a standing committee. Let's say you have 15 people on your board. You have a standing committee. Your executive committee would be a perfect example, where you have 4 members of the board, and you have no outsiders. So as long as, see, I got to get this right. So that is still a standing committee. But if you have small ad hoc committees, let's take her small ad hoc committees. If you add to your ad hoc committee a member of the community to supplement it, it becomes a committee that must be
The Brown Act. Yeah.
Brown Act.
But
compliant.
so a standing, but my question is, a standing committee that doesn't have a majority of the members, yet they are only members.
It's still a meeting because
It's still
it's
subject to
still
the Brown
subject
Act.
to the Brown Act because it covers subject matter jurisdiction. It's appointed by your board, and it meets at a standardized time. I mean, most of those meet every other Tuesday or whatever at such and such a time. So yes, it is subject
It
to the
doesn't
Brown
have
Act.
majority there, so how do you, it doesn't meet that majority?
It's still a meeting.
Okay.
Yeah, it's still a meeting. This is just the quick definition. So a special meeting, does everybody know what a special meeting is? A special meeting is a meeting that's exactly like your regular meeting, except that it is convened at a place other than the place or a time other than the time that you usually meet. That just becomes a special meeting. It doesn't change the requirements much. It doesn't change the requirements. Okay? You call special meetings for a couple different reasons. Often a retreat is a special meeting. And why is that? It's because you don't have it at the same time or place that you would have your regular meeting. Okay? So a retreat is often a special meeting. If something comes up and you have to have a public hearing within this period of time to pass your MHSA, to meet your MHSA requirements, that might be a special meeting. If the sewer overflows in the mental health unit, that might be a special meeting. That's actually an emergency.
If we hold our regular meeting same time but different place, is that?
Special meeting.
Anytime we meet other than our usual location.
So location, time.
But
Time.
that
Oh,
doesn't
either
really
one.
matter though, because they're both Brown Act, right?
Yes. Yes.
Like
But
an-
it's just,
Yeah.
instead of having, it's just not in your regular meeting schedule. You have a regular meeting schedule, you deviate from your regular meeting schedule, that becomes a special meeting or an emergency meeting.
So for instance, we set up a calendar before the start of the year, and we made like 6 different locations over the year, but it's in our calendar.
But it's in your calendar,
So
so
therefore,
you're
they're
good.
not special meetings when we go to another location, because it's already in our calendar that we're gonna meet at the Gowalla Library and Point Arena Library and Fort Bragg Mental Health Meeting and stuff like that.
Oh, okay.
But you still have to post it and all the same
Right.
Oh,
things
absolutely,
that
right,
you would have had to
absolutely.
do.
Absolutely. The requirements for posting are a little bit different for an emergency meeting. And they have, if for an emergency meeting, I mean, that would be, for example, when I sat on the school board, we had an emergency meeting when our sewer backed up and we had little turds floating through the school. You know, it was quite exciting. We had an emergency meeting. And what you're supposed to do then is just notify people that you are having an emergency meeting. And I have to tell you that every newspaper was there. You know, they never come to a regular meeting, but boy, you have little turds floating around your school and they're on it. Where can meetings be held? They have to be held within the jurisdiction of the legislative body, so that means for you, if they have to be held within the county. There are some exceptions to this, and I'm not going to talk about the exceptions because you could wander forever on the exceptions, but there are very few exceptions, and it's sort of like having an emergency meeting. They're very pointed. All meeting sites must be accessible. So what does that mean, really? It means you have to be able to get into them physically. Get to them. What does it mean about
ADA?
ADA compliant? I mean, if you have a person who's deaf who comes to your meetings regularly, you need to provide services to make that sure that that person can understand what's going on at the meeting. Okay?
How about for language? You know, if they are not fluent in
I would say that language would be included as well.
How would they do that?
So what most board meetings, for most boards, what they do is they have a kind of I was going to say disclaimer, but I don't mean that. A paragraph at the top that says, if you need special help to participate in this meeting, call this number ahead of time. Because you can't just walk in and say, I need a Hmong interpreter now. You know, that's not going to work. You know, so make sure that that's on your agenda so that when you post your agenda, those people have a telephone number to call. Because what is the whole reason for the Brown Act? To make sure that any person can participate in hearing the decision making. Right? Okay. So no member of the public may be required to register his or her name or provide any other information to complete a questionnaire or fulfill any condition precedent to their attendance. So, you know, if you go to the city council, they want you to sign in. If they want to call on you, you have to give them your name. You don't. Now, that said, how credible are you if you go, I'm not going to give you my name? How credible are you? I mean, really. You want to say, my name is Susan Wilson. I'm here from the Shasta County Mental Health, Alcohol, and Drugs Program Advisory Committee. You know, so think about it. But people are not required to. So one of the things that I encourage people to do is to get rid of will everybody in the audience please introduce themselves? Just don't. Just don't. Don't put people on just don't do it.
You can, that's something that we generally do when we do introductions.
Yes.
And then we ask the audience or the public.
Is there anyone that wishes to introduce themselves? Some people say, which is a legitimate way to do it.
So then I should ask if they want to, if they would like to. Most of the time it's only other staff anyway, but there's sometimes we get outside.
Yeah, and I'm not sure that the public really needs to introduce themselves. You know, on our attendance sheet where we have people sign in, we also have a big sort of disclaimer up there that says you do not need to sign this if you don't feel like signing it. You know, so if you have a sign-in sheet, please beware and take a peek at it, put something on it. Does that make sense?
Yeah, I appreciate that. Our new chair changed that. Before, everybody had been asked to introduce themselves. And he changed when he came on board a year ago.
Good.
Where we don't, which at first we were a little startled when he said, no, we're not going to ask people in the audience. They may choose to when they stand up to speak, but we were a little startled by that, and then we realized, oh yeah, it's partly compliance. I think it also helps people share their opinions a little more than they may not have shared before who are from the community.
It doesn't mean they can't be called on.
Yeah.
You know, you can say, hey, you in the orange sweater. Or, I mean, you don't say it that way, but. Okay. How are meetings noticed to the public? Regular meetings, and this also applies, I think, to special meetings. Agendas must be posted at least 72 hours before the meeting in a location freely accessible to the public. So, if you post them on the library and the library is closed on Sunday all day long, and your meeting's on Monday, when do you have to post?
Friday.
Thursday. Because the library is not open at night. People stick them to the window. That's the best way to do it. You know, our mental health department actually put a little glass thing. Where does it have to be posted? It has to be posted at least at the location where the meeting is.
Well, that's interesting. I think we put it on our website and we posted it in the paper, but it's interesting that it has to be posted at the location.
Right, Jane?
Never done that. I'm learning.
Well, you have Bagby Keene, slightly different.
Oh, okay.
This is Jane Adcock. Jane is the, what is your title? Executive Officer of the California Mental Health Planning Council. She's going to help me talk about the data notebook, but we're running really far behind, so just relax and enjoy yourself. So it has to be posted at the place where the meeting is being held. It has to be posted there, okay? And it should be posted on your website, should be posted, I don't know, if you can put it in the paper, that's great.
Would that be on the mental health website?
You should have something on your mental health website that says, click here to get the agenda. I mean, it should be obvious. It's not a secret location,
Right.
you know, where you have to dig and wander through. It's right there.
So you're getting into some areas that require staff.
Yes.
So could you talk a little bit about where these committees are supposed to get staff?
Well, the mental health department should give you staff.
Standard.
This is standard. You don't have money, you don't have a budget, you can't hire. I mean, actually, I think in LA County, they actually do have a budget. But I think that's the only county that I'm really aware of that has a budget that they hire staff with, yes.
Now, are you partially referring to a staff, someone taking, a secretary taking notes, for example?
Yes.
Yeah, ours is just saying now, they don't have to, mental health doesn't have to do that for us.
Well, you know,
But we have no
I
money.
mean, that's a hill I would go die on. I would say, I don't have money to hire somebody, you know. We are all volunteers. It's your job to help us meet our requirements. I mean, I bet there are very few counties that would dare to say that. I bet. Remind me what county?
Lake County.
Lake County, small county.
Small county. Yeah.
Not small county, big geographically, small population county.
Small population, yes.
Small budget
Going
county.
around.
No, they need to take care. That'd be my guess. Okay, what's included on the agenda? The agenda must specify the time and location of the regular meeting. So particularly important where you move around every month or whatever, you know, need to be able to look at it and say, I need to be here at this time, at this place. And this is how I get my Hmong interpreter if I need one. Okay? The agenda must contain a brief general description of each item of business to be transacted or discussed at the meeting, including items to be discussed in closed session. This is a place where I think almost every agenda does not meet the requirement, because agendas still say things like new business. What does that mean? You know, or old business. What does that mean? So it should say take action on, and then literally have the motion that you want presented. That makes it easier for the people who are making the motion, makes it easier for the secretary who is taking the minutes. Okay, does that make sense? So take action on approving the Mental Health Services Act PEI proposal for 2015. So when I look at the agenda, total stranger that I am, I know what you're going to talk about. It makes a difference whether I come to your meeting or not, perhaps, right? Mm-hmm. And I think many agendas do not meet this requirement. No action or discussion can be taken on any item that does not appear on your posted agenda except to briefly respond to statements made or questions posed by the public. So if it's not on your agenda, you do not talk about it. You do not talk about it if your board member brings up, I want to talk about blank. It doesn't even have to be something that you're going to make a decision about. No. Thank you. We'll get that on our next agenda. Thank you for your comment. You know, when you get public comment, don't be saying, oh, yeah, you know, that's a real problem, and everybody starts talking. Don't go there. When you're the chair, you say, thank you so much for your comment. Is there anyone else?
If it is the board member who is giving their report, each of us gives a report, and they talk about things that are not related even to the mental health board.
Well, then you say, and how does that apply, Jane?
And
then
then
you make eye contact.
Right. But I mean,
And
that is
you know,
not
that's okay.
appropriate, correct?
It's not
Just
appropriate.
because it's their period of time to be able to report.
And you know, I'll go back to, and some of you were in the room earlier when I was talking about written reports. We don't need people talking on and on. You know, I mean, if I was the chair of a board, I love to hear what people have done and what they've learned. But I would rather have bullet points. I went to LeBrun facility and did a facility evaluation. Here's a copy. Okay? But you can't do anything about that facility evaluation. You can't say it's good. You can't say it's bad. You can't say even we should do something about that because it's not on your agenda.
Okay.
So then you would say, I mean, if I was bringing you the facility evaluation, I would have ahead of time said, I want this on the agenda. Okay. Or you would say, as the chair, I think this is important enough that we need to discuss it further. We'll have it on the next agenda. Okay? Does that tell you how to kind of balance those things out? So you can't just talk about anything. If it's not on the agenda, you don't talk about it. It doesn't matter whether you're going to make a decision or not make a decision, makes no difference here. If it's not on the agenda, you don't talk about it. You're polite, you're helpful to the degree that you say to your staff, make sure that gets on the next agenda.
Now, who makes that decision? Does everything go through the chair first, and then the chair tells the secretary to put this on the agenda?
I don't know how you do your agendas. You know, that's a policies and procedures sort of thing. So usually what happens with agendas, in my experience, is that the executive committee meets with the mental health director and secretary and says this is what's going to be on the agenda next time. If you don't do it that way, I would suggest it's a really good way to do it, is somebody that's in leadership somehow meets with the director, because you don't want to surprise the director with anything on your agenda. So it's just the director, the chair, maybe vice chair, and the clerical person who's going to make up the agenda.
You know, I think this is a really good point to see where meetings go awry.
Yes.
Okay? Because looking at this, all right, I realize as a board member how important this whole statement is, no action or discussion. Except
it's a key word, this discussion word.
Because discussion is where we go wrong. Because we then take the step to briefly respond to statements made or questions posed by the public can take us down a long rabbit hole of discussing the response to the statement. Okay? And so where that balance is that, okay, is it, we get into a long discussion sometimes on statements made by or posed by the public question.
Right, so it's your chair's responsibility to say, thank you so much for bringing up that important matter. You know, maybe your chair would say, if it's something that really has to happen soon, maybe somebody comes in and says, LeBrun facility is closing unless we get help. Well, this is something you want to know. This is something you want to talk about. And the chair might say to the director, I think we should have a special meeting to discuss this particular topic. You know, I mean, it doesn't have to wait until your next meeting, but I have to tell you, in our world, there's very little that doesn't have to wait, that can't wait.
Yeah. No, I think that's a good point. I think I'll try and be more disciplined.
Yes, and it's the chair's responsibility, you know, and you know, one of the things that you might want to do when you get back is say, you know, I learned something at the beginning of the meeting. I learned something really important. And I need to tell you that from now on, we're going to comply with the Brown Act by doing it this way. Okay?
I happen to have lost kind of control for a minute on that. The public was trying to comment on the expenditures, MHSA stuff. And then it got into people to have things misinterpreted, and then the director responded, and then it was going back and forth, and I just felt, I've lost control because I'm not really familiar with this position. Unfortunately, I had somebody bail me out and call point of order. And, you know,
would that have been Carrie Martin?
You know what I mean?
Would that have been Carrie Martin?
Absolutely, yeah.
Boy, do I know your board.
I think what's important here is that really is where our meeting, I can see now that me as a new board member has not been adhering to that about the discussion piece. So I've not been supportive of my chair in helping him keep us reined down, because as a, you know, the chatty, effective, quote, effective board member, he hasn't been reining in those of us who are making comments, and we need to be more disciplined.
But I would go back to the point that I made initially, is that every board has its own culture. You know, I want you to remember that every board has its own culture. And you do not want to go from a chatty board that gets things done to a rigid board that doesn't get things done. So you need to know what the rules are and then fit them into the way that you do things.
Right.
So you can do that really nicely, you know, to put back here. You can very nicely say, oh, that's a great point. You know, we're going to keep that under consideration. Thanks so much for bringing it up. And you can say, I'm writing it down. You know, the director heard it. I mean, you can really reinforce, because a lot of times what people want to know is they were heard. Right? They want to know they were heard. They want to know that it didn't just fly into space. So if you just go, okay, next, that's not good. You know, there's a way of doing it that will help people move along. Okay, and we're way behind now.
I'll be quiet now. I'll be quiet.
You know, it's really good to discuss this, because then you know how to take it home. You know, agendas and other documents must be distributed to the body. So whatever you get, the public has a right to. And that's another place where mental health boards fall down all the time. So if, for example, I'm going to use you, your annual report comes, you have a copy, the chair has a copy, and maybe some of the board members have a copy. And this happened at our board meeting last time. There were no copies for the public. And they were sitting there talking about a document that we couldn't see. And, you know, I kind of stood up, you know, because I am the obnoxious person. I said, you know, I think that you need to make some copies for us. You should have seen them flutter and fly and get copies and come back and change the agenda so they could talk about it after we fluttered and flew. But it's really important that the public gets those documents so that they know what's going on. You can understand, if it's transparent, you have the same stuff. So you also have the right to get everything ahead of time, just like the board does. So the board usually gets their stuff 72 hours plus ahead of time, you know, about the time that it's posted You should get your agenda. You should not walk into your meeting and be handed your agenda. You should know your agenda ahead of time. You should have it with you. And so I get the school board agenda, ahead of time and all the supporting documents. I get the mental health board agenda ahead of time and all the supporting documents because I am a public person who wants to comment sometimes on those things. So your public has that right. Questions, May?
Just a comment. We also do ours in our primary other languages. We have all of our everything.
So things in other languages, that's really going the extra step to meet that requirement. I would say that most mental health boards don't even have that ability. Most. But that's exactly the way that it should be done. Does the public have the right to address the body? Absolutely. Public may address the members of the body on matters that are on or not on the agenda as long as they're appropriate. We talked about that earlier. They must be appropriate to the subject matter. They can preserve the proceedings by photography or electronic recording. We talked about that earlier. And they can even broadcast them to the community. Okay? Clear? All right. The body may limit public comment. So public comment is really a tricky thing, in my opinion. The public has the right to comment. You do not have to provide your name, but I think any public member should provide their name because then it gives you, my name is Susan Wilson, I'm here representing Right Road Recovery Program. All right, but you can't require them to, so keep that firmly in your mind. You can limit public comment, so you can limit them. The classic limit in California is 3 minutes per speaker per topic. Many people use a timer. Much more effective than, I think you've been talking for 3 minutes, that's enough. Because what if you give one person 2 minutes and 30 seconds and another person 3 minutes and 30 seconds? So if you have a lot of public comment or you're having a public hearing or something, take a timer. Have a timer. Have your clerical person use the timer. Okay? One of the biggest questions in California today is whether to have public comment at the beginning or end of the meeting. I say that public comment belongs at the beginning of the meeting, not at the end of the meeting. But I have been sorely disappointed to report that the Reading City Council, where I live, failed to listen to me when I requested that. So you can have it at the end. What's the point? I mean, for some, at the Reading City Council, my point was, you're not listening to the public because your meetings get over sometimes 11, 12, 1, 2 in the morning. There are no buses. If you're not a driving person who doesn't require sleep, then how do you get to make your public comment? So, I encourage people to have public comment at the beginning. Set aside 15 minutes. Have your public comment. Limit people to 3 minutes each. I want to go back just for a minute on this. So, what happens if public comment is negative? Is that okay? If they come in and they say, we think you did a really crummy job and you all stink. You have to sit there and listen, and you go, thank you for your comment, next. So I'd like to tell the story of this lady in Reading. They were putting in a building that was going to cause a lot of pollution. And so we call her the cat lady. She used to come to the board meetings, not the mental health board, this was the board of supervisors, dressed in a cat outfit with cat makeup on. And when they said something she didn't like, she'd go, like this. And they had the marshals take her out. She filed a suit. She was back in 2 weeks. And I tell you what, she hissed a whole lot more in 2 weeks than she had before. Before she only hissed on one topic. Then now she hisses on every topic. She has somewhere disappeared. So I think maybe she's locked up somewhere. No, I'm kidding. I don't know what happened to her, but people can say really downright nasty things, and they have the right to do that. That's the First Amendment. Okay, and if you don't like it, yeah, Shoshana?
There's a webinar question.
Oh, sure, just a minute. If you don't like it, then, you know, don't reinforce it. Don't make eye contact with the person. Just look down, you know, live through that 3 minutes. When the bell goes up, you go, thank you so much, next. You know, don't make faces, don't stomp your feet. Do not reinforce the poor behavior of your public. Yes?
Two comments or two questions. If the person who wants to make a public comment has communication deficits, what can we do to help him or her make a public comment?
Well, if they let you know, I hope you heard that. So if a person has communication deficits, wants to make public comment, what they should have done, hopefully will have done, is notify you that they are coming to the meeting, that they want to make a public comment, and that they need this assistance. So that's why I say on your agenda, try to put something that says call this number or talk to this person to get assistance at the meeting. You know, you don't even have to make a public comment to ask for assistance. So we have a woman who's deaf who comes to our Shasta County Board of Education meetings, and so we have an interpreter there for every meeting so that we can meet her needs. She doesn't even have to make a comment in order to have that. Was there another question?
If the person speaks abusive language during public comment, can we stop him from saying anything?
No. I mean, there is a limit. I mean, to be honest, there is a limit. But basically, you have to remember the First Amendment in our country is a valuable thing, and it says that you have the right to say whatever you need to say. I think if the language becomes horrendous, threatening, then you can glance at your marshal and say, would you mind speaking to that person for us? I would say, actually, that the mental health board is a place where you might run into threatening and horrifically abusive language. So if I was writing my policies and procedures, I'd think about that. I think, where is the line? And I would tell people where the line was.
Is it typical to have a marshal, though, present at a
meeting? Yeah. You know, sometimes some people do and some people don't. I mean, but I think mental health boards don't usually have marshals.
We have it's always good to have a law enforcement member as somebody on your board.
Right.
Just not only for this purpose, but because in justice and law enforcement issues are so much a part of the mental health mosaic these days.
I don't think it requires that you have a law enforcement person, but many people in their bylaws have put, and I know that we had in our bylaws, we always looked. The Welfare and Institutions Code requires that you have at least 50% family and consumers, at least 20% of each. So that leaves the whole other 50%. And what we did in our policies and procedures was we listed the kinds of people that we are looking for. So we kind of like having an attorney on there. We kind of like having a CPA on there because, you know, when we go back to your comment about it's all about the money, it's nice to have somebody that loves money. You know, we talk a lot about geographical distribution and getting people from various areas. Talk a lot about diversity and getting people from different ethnic groups and language groups and LGBTQ groups and so on. So, yeah. But I think that's not required by the Welfare and Institutions Code. That's something you would set up for yourself. So the most fundamental rule of the Brown Act is that meetings of the bodies are accessible to the public unless specifically accepted, and action taken at open meetings must be public in every way. The body may never use a secret ballot. Never, ever, under any circumstances can you use a secret ballot. Never.
I'm not sure
So, you know, like a ballot where you might have a written ballot and then you hand it in and it doesn't have your name on it? No, no, no. You cannot do that.
That's how I got elected.
No.
But I knew every vote. I knew who cast that vote.
Well, I always like to use, one of the things I do is, for the League of Women Voters of the Reading area, is we conduct, several, elections for Native American populations, you know, for tribal elections. And I remember one time we finished counting the votes and this one woman had lost and she had like 11 votes and she said, but I have 21 votes because my mother's voting for me, my grandmother's voting for me. And she was going through the list of the 21 she was supposed to have and telling me that I boo-booed because I counted the votes and I missed Grandma's vote and Auntie Jane's vote. So it has to be public. So when you have a closed session, how many of you had closed sessions? Yeah. Most people don't have to, you know, there are very specific things for closed sessions. So pending litigation, you know, any kind of lawsuit. I mean, it really has to be pending. It has to not be in somebody's imagination. You know, Jane Doe might sue us because we threw her out of the meeting. No. Okay.
Well, it would seem from these three that it would be seldom that you'd need to have a.
So
if you don't own any property, if you don't employ anybody, well, that's.
and see, y'all don't employ anybody. You don't probably own any property that you're going to sell. So pending litigation, you could be named in a lawsuit.
So
that would be
what type of immunity or vulnerability do we have as individuals serving on these boards?
You know, nobody's ever asked me that question. I'll find out.
Well, it's important.
It is important. But I would think because you're appointed by the county that you are covered by the county. That's what
I would think so too, but that's why I just asked the question.
We held a closed session for a couple of things that then we were told we couldn't hold closed sessions on. Just because of the nature of who we are, we were holding a closed session to interview potential board members. Yeah. And we were told, oh no, you have to interview them totally in public. So now we're looking at, is there a way that ad hoc committees can pre-discuss potential people who may be on the board, so when they come, it doesn't become such a personal interview in the public setting.
Yeah.
Are you saying that the public sits in on these interviews of our?
They have the right to sit in.
You can't close the
session. You cannot have a closed session. So a lot depends on how you set it up. So really, I would go with the ad hoc approach. Ad hoc committee is a short-term committee. It has only board members on it. So you don't want to invite a stranger amongst you. And it's usually specific to a topic, you know. So we're going to interview people for the board. And you would have an ad hoc committee. You wouldn't say you and you are going to be on the committee because you don't want to appoint people to the committee, which then puts you in danger of having to comply with the Brown Act. What you want to say is, anybody interested in doing some interviews for us? Okay, you three, great. Get together, you three, and figure out when you're going to do this. So think informal when you think ad hoc committee. And come back to us with your results. Make sure you put their results on the agenda. But if a closed session, if you actually have a closed session, you do not take minutes in a closed session, okay? Nobody that doesn't belong in that closed session is in that closed session. So a lot of times your director might not be in that closed session. Certainly your clerical person, if you have one, is not in the closed session, no minutes. And then when you come out of the closed session, you have to say, if you made a decision in closed session, you have to say, this is what we decided in closed session. Jane made a motion that we do this. It was seconded by Susan. The votes were as follows. Susan voted yes. Jane voted no. Purple voted yes. Brown voted no. And the final vote was 3 ayes, 2 nays. The ayes have it. Okay? Make sense? Okay. Gotta move. Closed sessions, not open. I think these are all the things I just said. No person may disclose any information discussed in a closed session. Okay? That's important. And actually, people have been punished for disclosing what happens in a closed session. Okay? For more information on the Brown Act, there you go. That's how to access it. And then I want to do one more thing before we, sorry, Jane. One more thing before we break. I want to talk about Robert's Rules of Order. I want to talk about Robert's Rules of Order. So I want you to take 3 minutes. Those of you on the webinar, find your Robert's Rules of Order quiz. It's got 10 questions on it, or 8 questions, actually only 8 questions on it. Go through and put true, false beside them. I'm going to give you 3 minutes. I broke my toe. I'm walking really carefully. I don't want to hurt anything.
Been there, done that.
Yeah. So, I don't know how many people we have on the webinar. So you have to be really clear about this. So what I thought we'd actually do, if it's okay with you, is break, have them grab their lunch, take it back to their seats. Now that you're most of the way through, I'll tell you that for some of them, the answer is question mark, maybe.
Yeah.
But I did give you the answers too. So if you wanna cheat, you can look at.
I would have cheated if I'd have known.
Okay, so let's just quickly go through this. Then I'll talk a little tiny bit more about Robert's Rules of Order. And let's just start with Robert's Rules of Order. When you want people to do something as a group, you have to agree about how you're going to do it. You know, it only makes sense. You have to have some ground rules. And, you know, that's the good thing about Robert's Rules of Order. The difficult thing about Robert's Rules of Order is they were first written back in the 1860s. You know, and they are very rigid. In order to make a motion, you must stand. You must get the attention of the chair. You must phrase it just so. You know, which is why, of course, I love Roberta. And I'm not suggesting to you that you make people stand up to make a motion and that kind of thing. But I am saying that you want to conduct your group in a reliable fashion, predictable fashion. You're very lucky. You have Terry Martin, who I'm sure keeps you right on target when it comes to Robert's Rules. I'm not a rigid Robert's Rules of Order person, but Jane and I actually are going to do some training with the California Mental Health Planning Council because we have been known to bird walk and go sideways and upside down and not know what decision we made after we made a motion and passed it. So those are the kinds of things that I want to talk about. So Robert's Rules of Order. The president can vote only to break a tie. False. You know, the presiding officer has the same rights as any other member of the body. You know, once a quorum has been established, it continues to exist no matter how many members leave during the course of a meeting. That's false. And I have to tell you, lots of people don't know that.
We do.
You know.
Once we have a quorum, we just go ahead with the meeting.
Doesn't matter who leaves.
Yeah.
You know, and you cannot make a decision unless a quorum is in the room. And so, you know, you'll see a lot of places, what they do is once they've established the quorum for a decision, they'll close the doors. So strangers can't come in so that the quorum can't change. If you get more voting people come in, the quorum could go up, right? The numbers could change. So I'm not saying you have to be that rigid. I am saying that if you don't have a quorum, you don't have a meeting. You don't have a discussion. You don't make a decision. You know, it's important to have a quorum at your meetings.
I thought if you announce I'm leaving and you leave, then then you no longer have a quorum. But if you kind of just walk out, sneak out the door, I'm gonna use the restroom, or somebody just gets up, you know, at door.
If they are not in the room when you vote, you do not have a quorum. Don't be having restroom breaks during voting. You don't vote on that many things. I don't think this is that big an issue, really.
So, for instance, in our county, people may drive an hour and a half to 2 hours to come to a meeting. So you really want a quorum, but if there isn't a quorum, would you not be able to still stay and have an informational meeting, or would you just?
I mean, technically, the answer would be no, you can't do it.
Okay.
That would be the technical answer. In reality, would I do that? Probably.
But
you know, people drive 2 hours to get to my meeting. Am I not going to do it? No. And that's what I mean. You have to figure out the culture of your.
Right.
You can't change Robert's Rules of Order. So if you happen to put in your bylaws you're going to follow Robert's Rules of Order, you better be following them.
But the other hand is what we would do is we may just still have a open discussion, but not a board discussion because we don't have a quorum. But we would not be taking minutes, and we would not actually open the meeting.
Yes. It's a non-meeting. It's a non-meeting. You're all
not
sitting in the room.
recorded. It's
Yeah. Okay. It's a non-meeting.
But once a quorum, if somebody came in an hour later and we were having this, we could then start a meeting.
Good. Did you have a question?
Oh, yes, about the president. President, like, if you have a tie, the president can't break the tie?
They can't.
But they can vote in other things too.
They get to vote all the time.
Right. Yeah. They can vote anytime. It's a trick question.
Do they like hold, are they the last to vote, or?
How about the president?
Then how can they break a tie then?
Well, there is no breaking.
There is no breaking a tie. They have a vote, period.
There are bodies in some cases that vote where the
Because that's
presiding
their rule.
officer does not vote unless there's
Like
a
the
tie.
Senate,
Like
yes.
the Senate.
Yeah.
So is that the chairperson that came?
Right.
The
But
chairperson?
that's not
I'm
the
telling
case
you,
here.
in your case, the chairperson has a right to vote on anything. Not just at the time to break a tie. They can vote on every single thing that's voted on. Does that make sense?
Yeah.
Okay. Abstention votes count. No. Abstentions are really refusals to vote. But they're still recorded.
Yeah.
Yeah, you can record them. A member with a conflict of interest with respect to a motion cannot vote on the motion.
True.
In the Brown Act, it's true. In the Robert's Rules of Order newly revised, the answer is no. So let's talk about the Brown Act. Yeah.
Possibly determines if they have a conflict. It's a lot simpler for them to simply acknowledge their conflict.
Right. So basically, in the Brown Act, what they require, and you're subject to the Brown Act, so you don't really care what Robert's Rules of Order is. Right. The Brown Act supersedes Robert's Rules of Order. So in Robert's Rules of Order, what it basically says is that if you have a conflict of interest, which is generally monetary, i.e. you get paid money by that entity, not only can you not vote, you must leave the room during the discussion. Okay? Because what happens if you sit in that room? Do people know how you're going to vote? Is 80 to 90% of language nonverbal?
Exactly.
I mean, would people be voting and somebody would be going, oh my God. I mean, we had this city councilwoman, Gracious, her name was Gracious. And every thought that went through her head was reflected in her face. And I remember one time I took Gracious to lunch. I said, Gracious, when you're going to think something like you sometimes think, you had best just cover your face like this, you know, put your hand over your mouth like you're thinking, stick out your tongue, and then move on with business. You know, because really, you must remove yourself from the room. So, an example might be you have a law enforcement person, the sheriff's office, the jail, sits on your board. Often they do. And as a board, you're voting yes on MHSA money to be diverted to the jail for a jail education program for the inmates. that man, that person, man or woman, needs to leave the room. Okay? That's pretty
But
clear.
let's say you have a consumer that's using the services of the agency. I mean, they wouldn't be able to vote on anything.
Well,
If you
it's tricky.
technically.
It's tricky.
And what about the board of supervisors? You might,
Right, it's tricky, and, the board of supervisors, I think, often doesn't vote. That person often doesn't vote.
even if they're on the board?
Yeah.
It seems like this is a really tricky area.
It's a tricky
My
area.
reaction is that's the person I want the most in the room.
On the board.
Is the sheriff's deputy to justify the reason.
But,
Even if they can't be there to vote.
right, but you can't do that. You can't do that. Okay, debate on motion must stop as soon as any member calls the question.
What is that?
You know what calling the question is? People go, I call the question.
I want to.
Carrie calls the question.
Discussion.
Carrie is an error on this. The purpose of calling the question is to stop debate on an issue. So the motion is on the floor, it's been seconded. I move that we move all the red-legged frogs from this pond to that pond. Okay? The motion is on the floor. People are tired of talking about it. Somebody yells, I call the question. That's what people usually do. What you're really doing is saying, I want to stop the discussion now. So when you do that, and you can use whatever language you want, when you do that, then you have to vote on whether you're going to stop the discussion or not. Because you do not want to limit, if more than half the people want to keep on discussing, actually it's more than 2/3, it has to pass by 2/3 vote, not just the majority, 2/3 vote. So, does that make sense to you? So once people say, yes, we do want to stop the discussion, then you immediately vote on the motion on the floor.
It's the highest priority.
Okay? Immediately. No more discussion. If, however, they don't say, yes, we want to do that, then you can just keep on talking till you're purple in the face. Just keep on going. Okay? Make sense?
Yeah.
Really important that the chair understands how to do that. It's really important.
Does the chair decide whether or not to allow someone to call the question?
No.
No.
Calling the question is not a motion that has to be recognized. That you can just, any one of you can say, call the question, I have to shut up, we have to vote.
Oh, is that right? So there's no choice?
No
It's
choice.
right
It's
there.
the highest
It
priority.
just stops.
Okay.
You cannot overrule it.
It stops for a vote.
Okay.
Right.
But if it's not passed, it can go back to discussion.
Right.
Okay.
So it votes on if they're gonna continue to discuss it
Right.
or
Right.
not.
And that, it's really important that you just think about it that way. It's a vote to decide whether you're going to continue the discussion or not. It's actually a very effective way of managing bird walks, and things that go. I mean, I've been known to make eye contact when I'm the chair of something, make eye contact, and I have a signal, and somebody will call the question. And, a lot of times people just keep talking because they keep talking. There might not be anything more to say on the topic. As the chair, can you sort of call the question? Sort of, you can. It doesn't have to go to a vote and stuff like that. But you can say, I think we've heard all the points on this. Are we ready to listen to the motion? So that it's important that as the chairperson, you keep that control. You can just say, I'm hearing a lot of the same stuff going around the room. So I think it's time for the motion. Does anybody object to that? If somebody objects, of course, you keep on talking. But you can sort of introduce the thought. And a lot of times if you introduce that thought, someone like Carrie Martin will go, call the question, and you move. Okay, anyone can add an item to the agenda. Brown Act, you cannot do that. But if you were strictly just a Robert's Rules of Order, yes, you can. A lot of meetings that I attend, I go to I run this group, Shasta County Citizens Advocating Respect. And at the beginning of the meeting, I always say to everybody, anything else we want to add to the agenda? So, depending on the group you're in, but if it's Brown Act, no, absolutely not.
Are you talking about like when the executive committee sets the agenda?
No, I'm talking about when you're in the meeting.
Oh.
When you're in the meeting and there's an agenda posted,
Oh.
that is the agenda.
Yeah.
The posted agenda is the agenda. Minutes of a meeting need to contain all the information from the meeting. No, don't hang yourself out to dry by putting too much stuff in your minutes. I have to tell you, and mental health boards tend to do this. You know, I have one person who staffs the committee that I sit on that writes 30-page minutes. Nobody ever reads those minutes. 30 pages worth. There's great stuff in there. It talks about the discussions and who said what to who and why and how and whatever. The rules are you cover the agenda, the action items on the agenda.